Welcome back. So next we'll be speaking about the ST and the ST segment and T wave. So first of all, let's review a little bit of physiology. So as we would have mentioned before, the P wave represents atrial depolarization. The PR interval represents the complete time from the beginning of the onset of the atrial impulse to the beginning of ventricular depolarization. The QRS complex represents ventricular depolarization, and then the T wave represents ventricular repolarization. And the ST segment is the isoelectric line between ventricular depolarization and ventricular repolarization. So what this means is during this period of the ST segment, there is no ventricular electrical activity, or essentially the electrical vector is supposed to be zero. So as we would have mentioned earlier, ventricular depolarization is a passive process, and repolarization, right, or the polarization of any cellular tissue, is an active process, which means repolarization requires blood flow, oxygen, and energy. So at this point in time, I'm going to use an oversimplification, right, to illustrate the concept, or to illustrate our concept. So I'll start with the T wave because that's more straightforward. So because ventricular repolarization, or repolarization of any tissue, requires substrate, energy, and oxygen, any situation that results in tissue hypoxia is going to impair repolarization. Therefore, we can at least conclude that repolarization will be abnormal under these circumstances. Hence, among other things, ischemia and infarction can result in T wave flattening or inversion. Now, infarction will affect both ventricular depolarization, because you will have damaged cells which are leaky, and it will also affect repolarization, right? So essentially the concept is, because the ST segment is a period between depolarization and repolarization, we would expect that ischemia and infarction can also affect it. Now, there are explanations that go into greater detail as to why ischemia and infarction cause ST depression and ST elevation, but I won't attempt to go into great detail into those explanations. I just want to bring home a concept that ST elevation and ST depression can be caused by ischemia and infarction, right? Because of the fact that that is the period, or that is the isoelectric period between depolarization and repolarization. So that being said, when we look at the ST segment, we're basically looking for depressions or elevations. All right, so that's all we're looking for, or that's the main thing we're looking for with the ST segment. And we'll go into more detail in the future as to what is normal and what's abnormal. Right? And with respect to the T wave, we're looking for direction. So is it upright or inverted or flattened, right? And we're also looking at direction, upright or inverted or flattened, and we're looking at the dimensions. So is it particularly large, right? Or is it particularly small? So in terms of the T wave being upright or inverted, right? There are some leads which this can occur normally, and these are leads V1 and lead 3. So the reason for this is that these leads are more rightward. So if we look at the diagram of the precordium, right, we can see that V1 is more on the right side of the heart, right? And if we look at the hexaxial diagram of the limb leads, we can see that lead 3, which is at 120 degrees, as opposed to lead 1, which is at 0 degrees. So lead 1 faces the left hand side, and lead 3 will be more on the right side. So because of this, right, because it's going in the opposite direction of the normal impulse, because the mean electrical axis of the heart normally is approximately this direction, 60 degrees. So because towards the left, so because lead 3 is towards the right hand side, and therefore the impulse would be going in the opposite direction of this electrode, right, the repolarization vector may be inverted. So again, in summary, in the rightward facing leads such as lead 3 and lead V1, the repolarization vector, which is the T wave, may be inverted without there being any pathology.